Good afternoon and welcome to Mercy Health Muskegon's Healthcare Spotlight, where each week Mercy Health will bring you important information that helps you become more informed and involved in your healthcare decisions. We believe that carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, all in an inclusive faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. I'm your host, Erin Patrick, the Regional Manager of PR and Communications with Mercy Health, and today we're talking about chronic wound care, which in the United States affects nearly 6.5 million patients. Chronic wounds have a significant impact on the health and quality of patients and their families, causing pain, loss of mobility, depression, social isolation, and even death. Mercy Health has recognized the need in our community to serve these patients, and today we have with us James Brown, who is the Regional Manager of one of the two newly built Mercy Wound Centers. Thank you, James, for joining us, and welcome to the show.
Erin, thank you so much for having me today.
So, James, first tell us a little bit about yourself. What does a practice leader or manager do at Mercy Health?
So practice leader is honestly just a more mission-friendly title that talks about the manager of the clinic. Make sure that we're always complying with Mercy Health's guiding behaviors to talk about bringing in patient experience, making sure that satisfaction, but also the whole experience, including the financial aspect, is met, as well as bringing together a team that's comprehensive, educated, but also can kind of be passionate and empathize with the patients.
Okay, well, thank you for that. I think that helps people understand a little bit more when they are entering into the office and they see that practice leader who maybe might greet them or help them become more organized or comfortable in the setting. That's what our goal is to do here at Mercy Health. What can you tell us about your Department of Wound Care? Why is this service so important to our patients?
Well, wound care really meets a need for the patients that don't really have another avenue to go to. Oftentimes, they've been going to their primary care. They've had multiple different ulcers a period of time, but they don't really know what to go to. And the next step when a wound isn't healing is really to get specialized. And it takes more than just one type of physician, more than just a primary care saying a bandage or some medication changes, really to take a non-healing wound and create an environment so that it can start healing in a wound care center, not just a normal wound care center, but a comprehensive one. There's multiple types of physicians that are all in one spot. So we're talking about general surgeons, plastic surgeons, vascular surgeons, getting podiatry surgeons that are coming in and that can all come together as a team and look at one patient and say, hey, this isn't healing. What are we doing wrong? What else can it be? It takes a lot of different approaches to it. Okay,
so tell us a little bit about Mercy Health's wound centers that we have both in Muskegon and Grand Rapids specifically.
Sure. So about 2 years ago, Mercy Health, they noticed in the community that there was a huge need for wound care. They noticed volumes increasing in the area, and they said, we really need to take it to the next level. So not only did they dedicate more than 16,000 square feet in between two locations, but they really ramped up. They built out two brand new programs, and they added different specialty therapies so that we could start treating wounds more advancedly and getting patients back out there. One thing specifically that they brought in was hyperbaric oxygen therapy, and hyperbaric oxygen therapy is just one tool in the toolbox, but it is quite amazing what it can do for a patient to take someone over that edge where before maybe they even had been coming to the wound care center before, but really take them to the next step so that they can start healing.
Okay, so hyperbaric oxygen therapy is what? It sounds pretty state-of-the-art. It sounds like it is, a technology that we are on the forefront of. Explain to me if I needed a wound treated with that type of treatment, what would that procedure look like?
So hyperbaric oxygen therapy it's a chamber. It's not an enclosed chamber. It's not like an MRI machine. It is a 108 inches long tube that's acrylic, and you can see through it.
Do you lie down or you stand up?
You do. You lie down.
Okay.
And the procedure really starts off where you come, you sit down on a gurney, and then after you sit down on the gurney, you lay back, and you're slid into this chamber. It's a tube that closes behind you, but you can see freely around you. You get a bottle of water and watch a movie. It's really not invasive at all.
Okay, so you're not, having to stay still like a statue, and if you sneeze, everything's ruined. This is something that is a little bit more patient friendly as far as those patients that maybe might get a little claustrophobic or scared. So tell us, keep going with this. I'm very interested.
Sure. So honestly, most of the women that come in, they look at me and they go, "You mean no one's going to touch me and I don't have to do anything for the next 2 hours? And I get a bottle of water and watch a movie? This is absolutely amazing."
Right.
But what's going on inside the chamber is really, it's just about you breathing and breathing 100% oxygen around you. And then the atmosphere around you is being pressurized. So this tube we fill with 100% oxygen, which normally you and I right now here in the studio, we're breathing 21% oxygen.
Seriously?
Yeah. So 78% of what we're breathing is actually nitrogen.
Okay.
And so when we change the atmosphere that you're around and it's 100% oxygen, and then we pressurize that, the amount of oxygen that every time you take a breath is increased. So if you will, just kind of go with me with a little explanation.
Okay.
Imagine a Coke can, right? That Coke can, when you open it up, it starts to fizz out. That's because someone at Pepsi or Cola, no product specific stuff, sorry about that, but
we're being neutral. We've listed both, so okay, go on.
So when you crack it, the carbon dioxide starts to fizz out, and that's because of the extra pressure and the concentration of carbon dioxide has been infused into that Pepsi or Coke. So when you're taking pressure and you put it and expose it to a fluid, what happens is that fluid starts to absorb the oxygen or carbon dioxide or whatever it's exposed to at the percentage and at the pressure that it's being treated at. So very simple, right? You open up the can of soda and it starts fizzing out. Now we're doing that to the blood. So normally, you and I right now, all the oxygen that our body's getting is really associated with a hemoglobin molecule, which is a fancy part of the red blood cell that just holds on to the oxygen, right?
Right.
So when you're in the hyperbaric environment, you're actually infusing that oxygen into the fluid, which all of the oxygen transfer in a body happens through a small vessel, the capillary beds, and it can't always host the red blood cells to get through there. So a diabetic patient with really calcified vessels that has small vessels disease where they're not getting enough blood flow to the foot now has supersaturated plasma, which is the fluid of the blood that can get into the smaller spaces. But
because of the pure oxygen and the pressure that you're treating the wound with in the chamber?
The amount of pressure we're using is really, honestly, about 33 feet of seawater's worth of pressure. So if you're scuba diving...
Can you feel it when you're a patient? Can you feel the pressure?
Not on your body.
Okay.
The only thing you feel is actually your ears popping like you're in an airplane.
Really?
Yeah. So there's small spaces inside your ear that have air. And the only thing that changes shapes is the air itself. So another good example to kind of understand what's going on, if you take a balloon and you blow it up, it's going to be half the size when you get about 33 feet under the water in the ocean. It's the same amount of pressure that we're applying. Now, at times, we treat patients at, we call it a deeper pressure, but more increased pressure in the environment that they're in to even further dissolve 100% oxygen into that fluid of the blood. We're talking tens of times the amount of oxygen in that person's body. Now, it's quite amazing what the body starts doing, actually, when you get all this oxygen to an area that didn't have oxygen before. And the ulcer, if that's what we're treating, or that area that's hypoxic, it starts looking like a gradient that's different. So a good example would be a ball on a hill. The steeper that hill is, that faster that ball is going to roll down the hill. When we're talking about partial pressure, or the amount of oxygen dissolved now in that body, is making that oxygen go from your blood system into the tissues further and faster.
So the oxygen, the excess oxygen and the increased pressure, I'm gathering, will heal wounds much quicker.
Sure.
And maybe with less chance of infection because you're healing at a faster rate.
Dramatically. And the oxygen itself is putting the wound into an environment that is very, very supportive of healing. And a lot of the body's functions, not just wound healing, not just anything that we actually treat, is supported by oxygen, right? The Krebs cycle, which is a fancy word for how we make metabolism, but a lot of different parts in the body all revolves on oxygen. And the more oxygen really available, the quicker they can perform their job. So one of the things that we talk about with hyperbarics is increased host resistance. So the body's ability to fight off infection is clinically proven to really take to the next level of infection control within the body, and it's the body's self-ability to heal itself.
So the hyperbaric oxygen chamber is something that Mercy Health has been using for how long?
So about 2 years ago, we brought on the hyperbaric chambers, and we actually started partnering with a third-party company that really just specializes in it, and they just bring to the table subject matter experts.
Okay, and who is this third-party company?
Sure. So Restorix Health is national leader in hyperbaric medicine and in wound care, and they employ a large majority of people of across the United States, of wound care centers, and they really just focus just on wound healing and just on hyperbarics. So where a hospital has a cardiology department, a vascular department, and all these other things that they have to worry about, this company just focuses, and all it is, all of our staff, they're all Mercy Health. All of our bills come through Mercy Health.
Yep.
Everything that really needs to revolve around Restorix Health is just about getting information.
Okay.
The best, awesome, research, all the clinical training that we need. It's a great relationship.
So how did this partnership become aligned with Restorix? I mean, how did you kind of connect the dots here?
Sure. So Mercy Health signed a contract just to say with Trinity and with Restorix Health at the same time, and they came together to decide that in the best interest of the patient was to develop a relationship so that they can continuously talk to the community, like right now, and explain to them about wound care so that we can reach the most amount of people and effectively heal wounds as quickly as possible. So Muskegon, very similarly, has done amazing programs here. They aligned with physical therapy, PTAs, and they have a lot of physicians here in Muskegon. It's quite amazing, actually, the program that they have. They had over 12,000 visits last year.
Wow.
That is enormous. And so the amount of absorption that Muskegon has developed, and they really treat every wound that comes into the health system, which is, I mean, it's phenomenal, the resource that provides to the community.
So tell me about the types of wounds that you're seeing these patients come in with. I know we mentioned at the beginning maybe issues with chronic wounds. What does that mean? And what other kinds of wounds do you see and treat?
Sure. So pretty much any wound, any open area of the tissues we will see. We specialized on the fact that we treat chronic wounds because we are the best at treating chronic wounds.
So for the community that's wondering, a chronic wound is something that won't go away or doesn't go away easily. Is that the correct definition? Sure.
So we would see any wound that's open, but in reality, if you have a wound, you don't always need to come to a wound care center or to a specialist. And you go to your primary care if you're concerned at any point in time. But the rule of thumb is if a wound hasn't healed by 50% in about 3 weeks to 4 weeks, you really need to talk to someone because there's a trajectory that a wound normally has. And the trajectory, the first part is it's inflammation. And the tissue around the area starts to swell. And that's where the body actually starts bringing in all these different chemicals and different cells that will help to heal the body. But then the next step is the proliferative phase where the body is actually reforming structures. It's migrating fibroblasts and all these other structures. And if you looked at scaffolding on the side of a building downtown, you'll see all these holes and gaps in between it. And the scaffolding itself is what we call collagen inside the wound. And then cells migrate into the collagen and fit there, and it's almost like structure for them to grow too.
So they fill it fills in the holes.
Right.
Yeah.
So the first part of a wound healing is it comes up and then it comes across that scaffolding. But so it should have done that in about 3 to 4 weeks. And if it hasn't healed halfway through and come all the way up, I would definitely suggest that you at least talk to your primary care.
And then, if your primary care sees you and the wound hasn't healed, that's how maybe somebody might connect to the wound care center.
And, Mercy Health has, in both regions, Muskegon and in Grand Rapids, they have opened up a whole avenue for you just to seek advice from us. And if you go to mercyhealthwoundcare.com, it'll actually come directly to me, and it shoots me a message, and I call you back directly if you put your information, and we can talk about it. And we can say, do we need to have a doctor look at it? Do we need to kind of talk to your primary care first? Is this related to what we do?
So tell me why you think wounds are a little bit of a taboo subject. Why don't people take wounds as seriously as they would, say, a broken finger or something like that?
So, well, first, in the provider world, wound care is still new.
Okay.
It really hasn't been around the same that cardiology, dermatology has been around. Wound care is relatively in the last 20, 30 years. But when someone looks and they see a wound, the first thing they do is they're embarrassed that they have a wound that's sticking around. Sometimes they smell. Sometimes they don't look great. Sometimes the bandages are clunky and you're trying to go to a wedding or something. And
Sure.
your wife wants to have her legs out, but there's something that's ugly. And then they get afraid because it's not healing, and they're afraid of what it may be. So in that situation, we totally respect privacy. We totally understand that it is a sensitive matter, and sometimes it's even painful.
And you guys have seen everything. This is what you do. So there wouldn't be any reason why someone coming in with what they think would be the scariest looking wound, it's not probably anything that you haven't seen or studied.
Sure, and you would be amazed at the things that we heal on a regular basis.
So go ahead.
I was just going to talk about, there's a lot of different types of wounds. There's diabetic ulcers, which are probably the most familiar with a lot of patients. And those patients with diabetes typically have been told from their primary care or from other doctors, look at your feet every day. And if you are diabetic and you're listening to this right now and you haven't been told that, you're being told right now. So there's no excuse. You really should be looking at your feet every single day, checking for fissures or calluses or any type of buildup, or checking between the toes. And after you're done washing your feet, make sure they're dry, especially between your toes. It's very important.
Why is it important for diabetics specifically?
Diabetics have a hard time healing. They really do.
And is that because you mentioned they don't have as much oxygen in the blood, or they have, what did you say, calcified
vessels?
Vessels?
Yeah.
Okay.
So sometimes with diabetes, you end up getting microvascular disease, calcified vessels, but also just metabolic processes revolve around the sugar in your body. And when they get out of control in different levels, that impairs the amount of wound healing that can happen, and fibroblast migration and a bunch of different things. But they have a more difficult time healing, and they often have peripheral vascular disease that makes it harder. So then, besides diabetic foot ulcers, there's venous ulcers, which often go on
What is a venous ulcer?
If people have venous stasis, or if they have edema in their legs or swelling, if you took a Sharpie on a balloon, and that balloon was, imagine that's the skin on your leg, and you made a dot, and then you blew it up, that dot's going to get bigger. So if someone gets a small crack, but then they have a problem with venous stasis and their swelling is really dramatic and it goes back and forth, there's mechanical pressures in the body as well as some other physiological things that are going on that is causing mechanical breakdown of that skin, and the tissue starts to break down as it swells up, and then you put your feet up at the end of the day and it shrinks back down.
So that wound is basically moving with the swelling in your legs or your feet. And so if you've had what was a small wound and it's being aggravated up and down, throughout the day, that's pretty much preventing the healing process or making it start over again or things like that.
So then there's surgical wounds as well. So a doctor goes in, and that's a big problem. And at times, the surgical site gets infected, or something else happens where there's a mechanical or physiological breakdown of that area where the surgeon closed. That's often, and frequently, those patients are the ones that don't come to us the most because their primary care says, well, go back to the surgeon that you went to before. And sometimes the patients are afraid of that because they feel that for some reason that the surgeon did that maliciously or they didn't do a good job. But in simple fact, it really comes down to it just happens sometimes.
Or maybe they're embarrassed, like, you get your marching orders after you have surgery and they say, okay, you need to be cleaning this X amount of times a day and you need to do this. And maybe they followed everything to the letter and it's still not healing, and they could feel embarrassed thinking like, wow, gosh, I can't even take care of my own wound, even with all the directions. So I can imagine that those feelings are probably something that you guys talk through with patients quite often.
Very, very frequently. And some of the options that those patients have, especially is like negative pressure therapy, where we actually use a vacuum-type device that goes over the top that mechanically helps to close the wound, bring up the bottom of the wound, but also it sucks out the fluid so that there's not drainage or smell, because oftentimes when you have a wound, there can be a smell that's associated with it, and that can frequently be from necrotic tissue. So surgical wounds specifically, often those are the patients that don't come. But then there's wounds inside the body that don't present themselves. So then there's sometimes wounds that we call deep tissue injuries, where down deep, by close to the bone or the muscle, someone had pressure. And
somebody hit them or they ran into something, or what kind of pressure are you talking about?
All sorts. So that's a good example. That's a traumatic deep tissue injury where someone did, like a car door is very frequent with us.
Okay. Yep.
And they get a hematoma and there's a blood pool that goes behind it. But then the deep tissue injury, they normally rely with patients that get a bed sore from
Yep. So who are in maybe an inpatient setting, or have are homebound for some reason, and are sitting in a position or laying in a position for a prolonged period of time.
Yeah, and unfortunately, the family members a lot of times in this situation are seeing that, and all they see on the top is just a little tiny purple dot.
Okay.
And that's really, think of it like an iceberg now. That's the tip of the iceberg, and every piece of that damage is underneath. Now, in our clinic, we see this all the time, and it's very unfortunate, but you have to go in and you have to remove that damaged tissue. So they might come to us at times, and they have a deep tissue injury, and eventually, like 3 days later, they're like, oh, it's just a little bruise, and then they have a wound on their backside that is the size of a softball or bigger.
So, community, if you're listening out there and you feel like you might have a spot that is concerning to you, that is just an opportunity for you to start a conversation so that things don't get to that point where you are now in maybe a little bit more of an intense therapy situation. How do patients know what treatments are available here in Muskegon? I know you talked about hyperbaric oxygen therapy. What other kinds of therapy do you use?
There's a ton. So when we were talking about venous stasis ulcers a little bit ago, about that swelling back and forth. So one of the biggest challenges is to remove that swelling from happening in that leg so dynamically throughout the day. So we actually do a compression wrap that goes from the toes all the way up to the knees, and it removes the swelling component of it, so the wound has a chance to heal. We use negative pressure. We were talking about the vacuum system that has a sponge that goes into the wound, and it pulls all that fluid out, but it also it helps to migrate some of the tissue up and to granulate that wound bed and bring it up to the top. We use extracellular matrices and advanced skin products, which are so fascinating to talk about. In short, if you guys probably know about inflammation, antihistamines, and stuff like that, it's a wonderful product that we have that actually does something similar to the body's reaction to the inflammation. So there's a chemical that's produced when the body has inflammation. There's chemicals in the body when there's an injury, then afterwards it starts to heal.
Right.
Those are called growth factors.
Okay.
So sometimes with diabetic, venous stasis, pressure ulcers, the body forgets that it has a wound. So one of the treatments that we do is cutting the wound, actually, what's called the debridement, to remove any of the necrotic tissue to promote growth, because then it sends that signal again. It's the podiatrists like to say that it's taking a chronic wound and making it acute again, meaning an old wound that's been there for a while, but reminding it that it's a wound and it needs to heal. Mm-hmm. If that doesn't work, we actually take a product, and it's very simple. It looks like a piece of cellophane, and it's called Epi Fix. Okay. And it's the amnion and chorion membrane of the placenta. So the afterbirth, after a lady has a baby, that tissue is so rich with growth factors, and it's so rich with a matrix of extracellular matrix that the body absorbs it. Then it takes this fertilizer, if you will. I mean, it's a really good analogy, and it uses it to start growing factor. And there's not a lot of things that give you the wow factor in medicine, but this is one of those things where you put it on the wound bed, and the next week it's just made insane progress.
That is so I mean, the body is an amazing thing, but to hear that scientists can develop these kind of products that can really make leaps and bounds in recovery for patients, that, even baffles people who have studied these types of topics is just an awesome thing.
So I agree. I mean, I absolutely love the field that we're in. And the extracellular matrix, honestly, you're giving credit to the scientists. It's Mother Nature. It's the body. It's the placenta. It's what Mother Nature's given us. We use other products too, like Meta honey, which is actually it's a manuka honey that's an extract from a plant. But if you look in your shelves at your grandma's house and you see the white sugar that's been sitting on the shelf for 20 years and you look at it, there's no bacteria on it. That's because sugar and fructose and other types of dextrose types of sugars, they're naturally antimicrobial.
I did not know that.
And the fluid in the inside of that wound is actually, a lot of it is good because it's going to carry some of those other natural growth factors that are in the body. So when we put this Meta honey, this honey on the wound, it promotes that fluid extraction. So you take that old white sugar and you put it on some strawberries, it starts to weep, the osmosis effect, right?
Right.
It's the same thing with a wound. So that's only one type of natural product that we use, but we do use a lot of things from nature.
So if there are 3 important takeaways for our audience, James, what would you say you want our community to remember about this segment?
Sure. There's help. And there's people out there that really, really specialize in wound care. And it doesn't have to be you that has the wound. Oftentimes, the referrals come from family members.
Right.
And we are here to serve whether or not your ability to pay, whether or not your wound is dramatically hard to improve. Our mission is to help people, and it always will be. So even if you're a little bit nervous about a wound on the back of your leg or one that may be presenting on the bottom, reach out to someone. And remember, you can directly contact me and talk to me just by going on mercyhealthwoundcare.com and fill out your information, and I'll be calling you.
Okay, and James, give us just a little bit of background. How did you get into this field? How did you end up at the Mercy Health Wound Care Center?
Sure. So I have an undergrads that's bachelor's in science, so I do have some clinical background. And then one day in Indianapolis, I started talking and I was presenting, and I said on concussions, ironically, and someone said, they use hyperbaric oxygen therapy for that, and I said, I have no clue what that is. And it kind of progressed to some amazing therapies, and I really started to research on hyperbaric oxygen therapy, and I just fell right in, finished my master's in healthcare, and then eventually went on through the National Board of Diving Hyperbaric Medicine Society and got credentialed through them.
That is awesome. I think it's kind of interesting, both, from just an interviewer's point of view, but the community, how people gravitate towards these types of specialties. We talk to specialists all the time, and I think, you're just a perfect example of somebody that just was amazed by what can be done for patients. And that's really what we want our community members to know, is that no matter how bad you think it is, we've got a solution, and we want you to seek help with us.
Well, Mercy Health provides an amazing opportunity for me to interact with patients as a leader. Not often do leaders get to be one-on-one with the patients. And I'd say probably the best part of my job is getting to put scrubs on and go in with the rooms, because those patients that are our patients and our friends, you know them personally. They come sometimes weekly, and you get to know their family, their friends, and even their dogs.
Yeah. Well, for those of you who are listening, I just really would like you to check out mercyhealthwoundcare.com. This is a place where you can fill out all your contact info, and James Brown, who is the clinic manager there of one of the locations, will get back to you personally, and you might find a new friend. He's got a really friendly face. You can't tell that by the radio, but I just want you to know that there are good people out there to help within our organization for Mercy Health. So thank you so much for tuning into our program today. Today's broadcast has been brought to you by Mercy Health Muskegon. Make sure to visit mercyhealth.com for more information regarding your health and what we're doing to support our community. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.